Hello, and welcome to Nursing Student News at 8. My name is Sabrina Hernandez, and I'll be your host today while we interview a patient about her treatment team here at Mission College Hospital. Today's the topic is stroke. Did you know that stroke is the 5th leading cause of death in the United States, and it's the leading cause of long-term disability, and that individuals who are overweight or obese are at risk for having a stroke? If you did, that's great. If you didn't, hopefully you'll learn some new information today on how to lower the risk for a stroke. Let's take a look over here now. Dr. Marie.
Hello, hi.
Hi, thank you for meeting us today.
It's no problem at all. So another name for a stroke is a brain attack. It's a sudden interruption of brain flow to a particular part of the brain, leading to ischemia, cell hypoxia, depletion of ATP, decreased perfusion, and cell death. In other words, a vessel carrying blood inside of your brain becomes blocked or tears. When this happens, the affected part of your brain no longer works properly and the tissue dies. There are 2 types of strokes, ischemic and hemorrhagic. An ischemic stroke is caused by an atherosclerotic development of a clot called a thrombi or emboli, blocking cerebral circulation. A hemorrhagic stroke is caused by a rupture of cerebral vessels causing intracranial bleeding. This is when the artery tears and leaks blood into the brain where blood is not supposed to be. So see over here, I have a patient who is now recovering from a stroke and has agreed to talk to you about some of the clinical manifestations or signs and symptoms of a stroke.
Great. Thank you so much, doctor.
Hi,
Hello.
thanks for having me.
Hi.
So my name is Ann, and I had a stroke 6 months ago. But luckily for me, I'm all recovered now. Not everyone recovers fully, though, so I feel pretty lucky. The doctor told me that my stroke happened actually on the left side of my brain, and it's also called the left cerebral hemisphere. A stroke on the left side of the brain can cause several different things like excessive or receptive aphasia, agnosia, alexia, or agraphia, and those are all defined as like the inability to recognize objects, words. You can't read, you can't write. You also have right-sided hemiplegia or hemiparesis, slow and cautious behavior, personality changes, visual changes, such as hemianopsia when you can't see through one eye. The doctor told me that if the stroke had been actually on the other side of my brain, the right side of my brain, my symptoms would have been much, much different. He explained that a stroke on the right side could have caused altered perception of deficits and unilateral neglect, which is the lack of awareness and attention to one side of my body, loss of depth perception, poor impulse control and judgment, left hemiplegia or hemiparesis, or visual changes such as hemianopsia.
Well, thank you so much, Ann, for sharing
You're
this
welcome.
information. We'll talk to Aung now.
Hi, Sabrina. Hi, I'm Aung. So it sounds like you got a lot of information so far. So next, I'd like to share with you what my role as a nurse is for a patient who is at high risk for stroke. As you mentioned earlier already, people who are overweight or obese are at a much higher risk for stroke. Since stroke causes a block of blood flow to the brain, I will first give them a nursing diagnosis of risk for impaired cerebral tissue perfusion related to unhealthy lifestyle choices as evidenced by a BMI of over 30. BMI is basically a body mass index, and it's an indicator of how much body fat you potentially have. Ideally, you want a BMI between 18.5 to 25. BMI of 25 to 30 is considered overweight, and a BMI of over 30 is considered obese. Since having a BMI of over 25 places patients at greater risk for stroke, it's important for me as a nurse to help patients achieve weight loss. So 3 interventions that I would implement for a patient who is at a risk would be to first identify a patient's motivation for weight loss. It would be very hard for such a patient who isn't motivated to make the lifestyle changes required. Next, I would like to provide a list of available resources such as Kaiser Weight Management Program to assist with achieving and maintaining a healthy weight. Finally, I will educate the patient on how to read food labels. This is very important because understanding food labels can help them make healthier, more educated choices, such as picking a food that is lower in fat. There's actually someone here from Kaiser who would love to speak to you about more specifically about health promotion plan for weight loss.
Great, thank you. Here today we have John from Kaiser.
Hello, Sabrina. My name is John. I'm from Kaiser, Santa Clara. And Nurse Aung went over many beneficial interventions for lowering weight and ultimately lowering risk for stroke. One intervention that he mentioned is to identify available resources in your community. It can be the key to promoting a healthier lifestyle. Kaiser offers weight management programs at many locations to its patients, which include a group of experienced physicians and educators who provide you with medical supervision, behavioral and nutritional advice, and weekly support sessions. Once you enter the long-term maintenance phase of the program, you can attend weekly group sessions to help you keep on track and stay motivated. The ability to make healthier choices on a daily, ongoing basis takes more than knowing that an apple is a snack choice than a cookie. It's a learned skill. We can give you the tools you need to build healthier daily habits and deal with challenging situations in a positive way, so you're more likely to succeed in keeping weight off. Our program curriculum is based on the principles of behavioral science. We'll work with you on skills such as getting realistic goals and designating action plans, self-monitoring, and problem solving. We understand that not everyone is a Kaiser patient, but I assure you that many local hospitals offer a similar weight management program to help with achieving a healthy weight and BMI. I'll make sure to give you a brochure with lists of several other hospitals that offer these programs before you go.
Wow, thank you, John. I didn't know such programs existed. A patient who's motivated to lose weight should definitely look into this. Now, let's go back to Dr. Marie. She's here. She's going to tell us about some diagnostic
Thanks
tests.
again for having me. Okay, so when we see a patient who has these clinical manifestations, some of the tests that I would order would be BMI, CT scan, a CAT scan, an MRI, an angiography, a carotid duplex ultrasound, and a transcranial Doppler. We would also order a PT-INR and fibrinogen for clotting, a lipid profile, a CBC and CAM7, a lumbar puncture test, and a Glasgow coma scale. Oh no, the hospital is paging me now, so I'll have Nurse Aung tell you some about the treatments.
Thank you so much,
You're
Dr.
welcome.
Marie.
Nice to meet you.
Nice to meet you. Next, we have Nurse Aung.
Hi again, Aung here. So earlier I mentioned some nurse intervention that I would do for a patient who's at risk. But now I'll tell you some of the medical treatments that can be performed. So if the stroke is an ischemic stroke, TPA can be administered, and TPA is a clot-busting medication. A mercy retriever can also be used as a procedure to bust the clot, and it's the long thin wire inserted first into the femoral artery near the groin, and then sneak into the affected vessel in the brain. The balloon is then inflated to prevent blood flow while the retriever wraps around the clot, allowing it to be removed. There's also the penumbra system, which is the newer method, but I won't go into detail about that. If it's a hemorrhage stroke, the treatment is quite different. In this case, the procedure such as clipping the aneurysm or the coiling the aneurysm is appropriate. Both of these methods will prevent further bleeding into the surrounding tissues in the brain.
Thank you, Aung.
Thank
Please
you.
be sure to thank Dr. Marie, the patient Anne, and also John from Kaiser.
Of course.
Thank you so much. We covered a lot today about who's at risk for the stroke, the pathophysiology, the clinical manifestations, diagnostic tests and treatments, a health promotion plan, and a nursing diagnosis with interventions. One thing I wanted to make sure all of my viewers are aware of is how to identify if somebody's having a stroke now. It's easy. You just gotta act fast. F is for face. Ask someone to smile. You're looking to see if they have any weakness on one or both sides of their face. A is for arms. Ask them to hold both of their arms out. They should be able to raise both arms equally and keep them raised. S is for speech. Ask the person to speak in simple sentences. And T is for time. If you observe any of these signs, make sure to write down the time and call 911 immediately. Thank you, everyone, and I hope you have a great day.